before we start the exam of the thyroid, I want to go over some normal anatomy. So if you're following along with me, I want you to put your finger at the tip of your mandible right there. Your finger down the midline, and the first hard thing you hit will be the Adam's apple, or the thyroid cartilage. The top of it, the prow, is the first hard thing you'll hit. And I've got my finger right over it. I will try and put a little arrow there so you can see it. Now continue your journey on your own neck with your finger. Now slide down the prow of the thyroid cartilage, and when you get to its lower margin, you'll hit a little indentation that you can put your fingernail into, and that is the cricothyroid membrane. And so right below the thyroid cartilage, the little indentation, that's the cricothyroid membrane, and then comes the cricoid cartilage. So I'm going to put this sticky on the cricothyroid membrane. If you were doing a transtracheal aspiration, for example, this is where you'd go. You'd go right into the trachea. Below the cricothyroid membrane is the cricoid cartilage, and then, especially if you're looking from the front, what you're left with from down here are the first 2-3 rings of the trachea. And the importance of this is that the thyroid gland isthmus does not lie over the thyroid cartilage, despite the name. The isthmus of the thyroid gland lies right here over the first 2 rings of the trachea. Now what I'm going to do is get behind you, and because I know my landmarks, I'm going to find the thyroid cartilage, the cricothyroid membrane, the cricoid cartilage, and the first 2 rings of the trachea. And then I put my 2 fingertips over the 2 rings of the trachea. And now put my thumbs back, and I flatten my hand out like so. So my fingers are flat against his trachea. I should feel the isthmus there, and now I drag my fingers back a little bit, and again they're flat and resting against his thyroid gland, and I ask him to swallow. And what I'm trying to see is when he swallowed, did one set of fingers go up different from the other? That's how you tell the presence of a nodule. One more time, please. And while I'm at it, I can then push the thyroid gland to one side and use my other hand to palpate if it's enlarged, and do the same thing on the other side. Some people do this from the front as well as from the back, but I think it's real important, first of all, to find your landmarks and make sure that you remember that the isthmus of the thyroid gland is well below the thyroid cartilage, and the 2 lobes go up laterally like this, laterally below the thyroid cartilage.